Joining me now, Democratic former Governor Ted Strickland of Ohio and former Gingrich campaign spokesman Rick Tyler. Good to see you guys. Good morning.
Good to be here.
Good morning.
Governor, the latest polling shows that while most don't approve of the SCOTUS decision to uphold the individual mandate, the majority do support the overall law itself. And actually, the issue of repeal is pretty mixed. Should the president leave it alone now, or does he need to continue to make the case, certainly for the individual mandate?
Well, I think we should make the case. I think the president should press forward. The individual mandate, as we all know, was Mitt Romney's idea. He implemented it in Massachusetts, and it's working well in Massachusetts. And, Chris, one of the things that bothers me about the Congress having this vote to repeal Obamacare is that the people casting that vote, the Republicans casting that vote, are themselves receiving taxpayer-subsidized health care. And I think, really, to be fair, if they want to take health care coverage away from 33 million Americans, they should at least give up their own subsidized health care.
Rick, is there some hypocrisy there on the part of members of Congress who get health care and continue to get health care?
Except what the governor is saying is every American would like to have the exact kind of coverage that Congress has, where they have their own choice of doctor, their own choice of hospital, and so that's not included in the Obamacare. And certainly they're getting health care coverage because their employers are the U.S. government, and yes, that is federally, but I think it's a little bit unfair because the Congress is in a completely different system than what's being proposed on the Americans by Barack Obama and Obama Roberts Care.
Well, when I was a congressman, for the 12 years I was in Congress, I accepted no taxpayer-subsidized health care because I thought it was unfair for me as a congressman to take subsidized health care from the taxpayer when so many of the people that I represented had no access to health care. So these folks make a good salary. Let them put their own behavior where their rhetoric is. It's easy for them to say, we're going to take away health care from poor people, but we're going to accept it for ourselves. I think it's hypocrisy, and I think the American people recognize hypocrisy when they see it.
Well, there's another criticism, Rick, that has been leveled about this repeal vote, that it's not going anywhere, and it's little more than a political set of scare tactics. What do you say to that?
Well, I say it gives the American people a clear choice between Obamacare and what the Republicans would propose, which is repealing Obamacare. Obamacare won't work. It's an irrational system. It's maniacally stupid. It has no free market incentives. All it will do is limit access, and as you're discussing here today, it will put more people off of insurance. Remember, Obamacare passed, and the Supreme Court passed it, yet we're talking about now that we're going to have less people insured. That seems to me to be the exact opposite in the direction Obama wanted to go. We'll have less access, premiums will be more expensive, health care will be more expensive, and 83% of doctors have already considered getting out of the profession. So exactly at a time when the baby boomers need health care, doctors are considering getting out of the profession. That can only lead to one thing, rationing. So higher costs, rationing, less care. That's what Obamacare is going to get us. Everywhere where free market is in the healthcare system, and those things that are not insured actually have gone down. Higher quality, improved better cost, higher quality, more access to care. These are things like liposuction, cosmetic surgery, certain dental procedures. All those costs, LASIK, those have all gone down. Those are all in the free market. Why? Because they're not mandated for care. If we actually return to free market economics, you'd have lower costs, better quality, more choices than you would with Obamacare. But we decided to go in the opposite direction.
Clearly, part of the Republican message is resonating when they keep saying too much government, too expensive in a time of economic uncertainty. I want to play for you. This was just a little while ago on the Daily Rundown. Kathy McMorris-Rodgers said this about the ACA.
America needs health care reform. Obamacare is the wrong prescription, the wrong health care reform, and we need to get it off the books and press the restart button. And then we need to look at those policies that will ensure that there's access for every American to affordable health insurance, health care in this country.
Would you agree, Governor, that there are parts of the plan that maybe need adjusting or fixing, and if so, how do you approach those?
Well, Chris, the president has said that he's open to making changes as we go forward. But the fact is that the only part of Obamacare Mitt Romney and most other Republican leaders object to is the Obama part. They say they like dealing with pre-existing conditions. They like getting rid of lifetime caps, on and on and on. In fact, after the Supreme Court ruling, Mitt Romney stood before the Capitol Capitol, and he said, we want to get rid of Obamacare, and I'll do it on my first day. I'll take coverage away from 33 million Americans on my first day in office. But then he proceeded to say, oh, but we like the fact that we ought to have provisions for pre-existing conditions and so on and so forth. The American people like the Affordable Care Act when you explain to them what it actually does. What they are being confused by is talk about liposuction and all this kind of crazy stuff. What we have in this country are millions of people without access to quality, affordable health care. Obamacare will provide that for them, and that's why I believe the president needs to move forward. We need to move forward to make sure that this plan is implemented. And, you know, when Mr. Romney comes up with some ideas of his own, we'll listen to those, and maybe we can incorporate them.
That's the criticism, Ted, that we don't have a strong alternative on the Republicans. And the governor is right about the polls. People do like coverage for pre-existing conditions. They like the coverage for their kids up to 26. There are many provisions of this health care law that people like and don't want to see go away.
Of course they do. But nobody is denying people of health care. You can go out, and the governor's wrong. We have the best access in the world. I was in a hospital yesterday that doesn't even actually accept Medicare, and it is the law. It is stated right there in the waiting room.
Then why are so many people, for example, in Texas uninsured?
Because they can't afford it. What we need to do is get the cost to drive down the cost of insurance and raise people out of poverty. We're doing nothing to address those things. You've got to get the cost of health care that can only be done in the free market, and you've got to get people wealthy enough to afford insurance in the first place. That's why nobody's denying coverage. Everybody can go out and buy an insurance policy if they can afford it. Now, there are those who can afford it who won't buy it. That's a problem. We can address that. But why don't we just give everybody a $7,000 tax credit? And you can use that money to purchase insurance. And if you don't want to use it, then it stays in the government for some general fund for those who don't want to get insurance, and you'll be stuck in that fund. There are lots of solutions to this problem. It doesn't have to be, you don't drive a wedge, a government wedge, between a doctor and their patient, where doctors are actually legally liable for making decisions about a person's health care. That's just wrong.
Rick Tyler, to be continued. Governor Ted Strickland, thanks to both of you.
Thank you, Chris.